In 2010, Ilfracombe Town Council developed a strategic plan. And the objective one of our strategic plan was to actually take management of our own town. And that's why we applied to become a government pilot in neighbourhood community budgets, or the programme we now call One Ilfracombe. I was born and brought up in Ilfracombe. I've seen the good times and I've seen 40 years of deterioration of our town, and there has to be a better way of delivering services in our town that are more cost effective, serve the people better, deliver better value, make people feel part of our community.
The reason that the North Devon Council is involved is because I think even at district council level we've realised that we've become overcome with layers and layers of bureaucracy, and decisions about communities like Ilfracombe tend to come top down, and dare I say it, we tend to have a we know best attitude sometimes.
It's so long-winded that one gets really frustrated, and I can see that the One Ilfracombe board can shortcut bureaucracy, can get things happening and realise the potential of the town much quicker.
The County Council is very keen to be involved in this pilot because it tests our risk appetite for genuinely embracing localism. It provides an opportunity for us to learn with partners some of the benefits and some of the risks of this approach, and importantly it will enable us to think about localism for other towns across Devon in a new and different way.
We've been involved with this project from the outset, and I see it as a really exciting and fantastic opportunity for the people of Ilfracombe to have a real say about how the money is spent and how the resources are used for the betterment of their community.
From going out in the community in Ilfracombe, I've really found that people have enjoyed speaking to somebody from the council on the street.
Clearly, we are very, very much involved in the Ilfracombe Neighbourhood Community Budget pilot. I guess the police are no different to many other partner agencies and many residents within Ilfracombe as well, that times are tough, economic conditions and national austerity measures, so we can't just do things in the same old way. We've got to do things differently.
As part of the partnership working on the neighbourhood community budget, we aim to actually empower local people to make the decisions and to identify the requirements for Ilfracombe. And by doing that, we then need to actually be able to align and hopefully pool services and budgets to actually realise the improvements that we require.
I'm really excited by the One Ilfracombe project, understanding where the whole country is in terms of the economic climate, for all partner stakeholders really to work together to actually think about how can we effectively use the resources within a health community to the best effect for the people who are living in that community.
Through this pioneering work, we can realise the potential of Ilfracombe a lot quicker than if we rely on the local councils.
What's really interested me is the focus on prevention, and I know from a fire service experience that prevention is better than cure.
And I think that's what's so exciting about this particular pilot, is the aspirations are quite radical, and it's challenging us to do things differently. It's challenging us as partners to build more effective partnerships between ourselves and with the community. It's looking to avoid duplication, and it's looking to take opportunities where we can perhaps share services.
Devon County Council has been focused on localism for some time. However, what is new with One Ilfracombe is doing that very differently. Historically, Devon County Council has looked at localism from a top-down approach, and on this occasion, One Ilfracombe is very much about looking at that from the town level and looking out and upwards.
So for the NHS, I think it provides a really good opportunity and a way of working that we would hope to perhaps be able to replicate into other towns and other areas within Devon, in terms of how we can work much better, get rid of the silo working and create further opportunities and improve communities in terms of not just the health, but all those other stakeholders that we're working for in terms of housing and everything else.
Most importantly, and something we've learned already in the police service, is that need to involve the community in making those key decisions and deciding what it is that they want us as partner agencies to be doing.
More personal for people, because they don't enjoy the process of coming in and feeling intimidated.
So from a crime and disorder perspective, you know, we've already know you've got to work together if you want to make the big changes.
Youth employment and enterprise is one of the key priorities for the neighbourhood community budget, and we as partners want to do the best we can to actually help and support young people in Ilfracombe and actually work with partners and employers to come up with local innovative solutions to help them get work.
And I think that for Ilfracombe to fulfil its aspirations, the decisions about it have to become bottom up, and to do that they've got to be community led, and therefore we've got to hand over decision-making powers to the community so that they can do what's best for them.
Our future is in our hands, and working with many of our partners, we can deliver something better for our community that will not just serve the town now, but serve future generations. This is a step change in localism, and we fully support everything that our partners are trying to do with us to make things better for our community.